Hey, this is Don Walters coming to you from theclinicaltrialsguru.com. Hey, I recently did a video talking about recruitment and about pounding the pavement and trying to get patients and what it takes. And as I indicated before, it's a lot of work, and a lot of people don't want to do that work. They want to do it the easy way. They piggyback off of people like me, or if I send a client in and they want to piggyback off of that client that I sent in, and I think that's wrong. Instead of going out knocking on the doors the way I do to find these people, they want to let somebody like me go out and find the people, send them all to them, and then they'll piggyback off those people trying to get patients. And that fails in the long run, because I've watched it, and I watch it happen now. Because what goes on is that you don't always get good people, because these clients, especially if you're dealing with mental illness clients, they can't go out and talk about inclusions, exclusions, and stuff. Yeah, they can go out and ask who's schizophrenia, who wants to go into a study, and call these people and tell them I sent you. That's the extent of it. And then you might get some good people, and you might run into a time where you get a run of good people. And other times you get a run of people that don't qualify, and you just wasted a lot of money, a lot of time. And where you may have gotten some good people, and where you didn't get the good people, one wipes out the other. The only thing you can do is go out and do what I do, and what some of the other people like me do, is go out and knock on the doors. Now, with this particular study, it's sort of a niche study. It deals with schizophrenia, and there's some specific things they're looking for that are not typical of some of the other studies. So one of the things we're dealing with is, for instance, is looking for predominantly negative symptoms. And you have to know what all that stuff is. And I've been working this long enough that I do know what negative symptoms are. And if you don't, sit down and talk with your PI, and have your PI or your psychiatrist tell you what the negative symptoms are, and where they need to be targeted as far as scoring on that. And I'm not saying you need to go out with these people and do an actual rating, but at least you can ask some questions to find out if they're in that ballpark. There are areas they need to be on with positive symptoms and the negative symptoms, so you need to understand the PANS. If you don't, again, try to find out from your doctors on what you need to get as a visual, and also understand verbally what the patients are telling you that may help them fit within that arena of what you're looking for. Now, here's how I go about it. I go out and I for instance, what I did yesterday evening, I met with the caregiver. She asked anyone who's schizophrenic and would be interested in hearing a presentation about research and a study they're conducting. So the people come in, I talk about research first. I go in, I talk a little bit about research. Through that, I segue over to find out who's done research. Once I find out who's done research, if they have, if they haven't, if they have, then I address those issues to find out if they've got any negative experience, positive experience. And then from that point, once I find that anyone's interested in hearing more that I want to talk about, then I sit them down and I tell them exactly, this is what I'm doing, this is what we're looking for. Are you interested in coming in for screening? And I'm not telling them that they're going to make it into the study. Oh, we're going to put you in. You never do that. That's wrong. And I tell them we'd like to bring you in for a screening to see if you qualify. And if you qualify, this is what takes place. I tell them exactly what they'll go through, what their experience will be when they come into the door. Now, if they're interested, then I go in and I get demographics on them, name, address, and that kind of stuff. Always get height and weight so that you can determine the BMI, because a lot of these studies have BMI. And of course, a lot of studies in the psych area I'm running into, they're having a cutoff age now at 54 and 55 years of age. So you want to get all this information. I try to get a little family history to find out if there's anything there that might support what's going on with them. Any past history of hospitalizations, things like that. When they were first diagnosed, that sometimes can indicate too what's going on with them. And you want to find out if they completed college, because or not college, but high school, and how far did they go along, because you need to determine if they can read or not. If they can't read, you can't really put them in the study unless you're going to have an interpreter there, which can create other problems, and we try to avoid that situation. If they cannot read, then there's somebody that we really cannot bring into a study. They need to be able to read to some extent so they can understand the informed consent. Once that's done, I kind of go through and ask some other questions to find out where they're at with their diagnosis. I have a list of questions that if you don't know what to ask, get with your clinicians, your coordinators, and find out what questions you need to ask and what type of answers you need to look for, and to place them in the ballpark. So I go through and I ask a list of questions. I find out what's going on. I gather that up. I have them get their medications and bring their medications to me and allow me to document that information. So I can take that back to my coordinators and my doctor and have them take a look at it to see if there's any exclusionary medications. And in addition to that, you should have some knowledge of what's exclusionary off top, but sometimes you may run into medications you're not familiar with and you don't know. So you want to jot everything down, bring it back, give it to your coordinator, give it to your doctor, and discuss what you have. Find out if who's good, who's not good, if they look like somebody that we can bring in and screen that might possibly qualify. That's how you do it. Now, if you take that process, I know it's a timely process, then you've increased the odds that this person is going to qualify. If you don't do that stuff and you do it like everyone else or a lot of other people are doing, is just throwing stuff at the wall, hoping it sticks, that's what you get. You get a lot of stuff dropping off the wall, and you waste a lot of money screening people and trying to get people in. Of course, again, as I shared with you in the past, there are sites that will qualify anybody and everybody, which, I won't get into that right now. But anyway, that's how I go about it. That's how I do it, and I've done it for years. I've been successful at it, and I've helped larger sites in being very successful at recruitment. Anyway, this is Don Walters signing off from theclinicaltrialsguru.com. Have a wonderful day.